Hi, this is Dr. Artie Kavanagh at RWCS 2019. We have a great conference, and one of the highlights of the conference are some of the case presentations by the fellows. So very happy to have a presentation from the University of Colorado. Dr. Mosa is going to tell us about a very interesting case with some interesting therapeutic options. Dr. Mosa.
All right, thank you. Today I'm going to talk about this very interesting lady. I know most of our patients in rheumatology are interesting, but this one is kind of like stood aside for me. She's a 35-year-old lady who was initially diagnosed with antiphospholipid antibody syndrome based on 3 consecutive miscarriages and non-bacterial endocarditis, and was started on anticoagulations. And like shortly after she was discharged, she came in back with diffuse alveolar hemorrhage. We had to stop anticoagulation and start her on steroids. But as soon as we stopped the anticoagulation, unfortunately, she developed MCA stroke. So at that point, we had to decide to go aggressive as far as like immunosuppression, and we gave her 3 rounds of rituximab, Imuran maintenance, and 4 cycles of IVIG. However, her antiphospholipid was persistently positive, so after the 3rd rituximab infusion, she was pretty much immunosuppressed, and unfortunately she developed bacterial endocarditis. And at that point, we kind of want to decide what is the next step, because she bled with anticoagulation, she got infected with immunosuppression, and we thought the IVIG was ineffective because she has persistently positive antiphospholipid. That brought the question of the possibility of starting her on eculizumab, which is a monoclonal antibody against C5, but we had to think about the possible side effect, especially with her recent endocarditis, and not to mention the very high cost of the eculizumab. As of now, we have back and forth discussion with her insurance to whether they can approve the eculizumab. So I kind of like took advantage of this opportunity to ask an open question whether should we proceed with the eculizumab and giving her prophylactic antibiotics, or should we just continue on the IVIG and the rituximab.
Well, it's interesting. One of the things we see in rheumatology lately, isn't it, is that we use autoantibody tests. We love autoantibody tests, but this case has 2 factors that could influence how you interpret the test. One is she's getting rituximab, which could conceivably decrease autoantibodies with or without concomitant clinical improvement, but also IVIG, which contains autoantibodies. So whose antibodies are we measuring? But it sounds like the eculizumab, we certainly think about the meningococcal infection, but it sounds like it might be a reasonable way to go, a very difficult case.
Right. Especially with if you look at the pathogenesis of the antiphospholipid antibody syndrome, it has this is where the eculizumab will act by blocking the conversion of C5 to C5a and C5b, which will develop the membrane attack complex that will participate in the inflammation, thrombosis, and fetal death.
All right, thank you very much. Excellent presentation, interesting case, and that's all for now from RWCS 2019.